Hello， 大家好啊 ！Welcome to the Art of Hong Kongese by Dummy。我係 Dummy，I'm Dummy. So I've already done a podcast episode on this coronavirus and Wuhan pneumonia. But I want to do it slightly differently for this YouTube video because I've realized the country where I reside in, people are not really aware of this virus and they think that it's kind of similar to a flu. I can guarantee you it's nothing like a flu. So anyway, this episode is going to be focusing more around this coronavirus in Canada and what we can do about it. I am aware that a lot of people that reside in Canada are not able to access any kind of Chinese resources because they don't understand Chinese. So I'm going to be helping you guys in bridging the gap so then you guys can actually see what is going on in Wuhan, and it's nothing like you think or imagine. It's way worse than whoever is telling you. So what do we know about this coronavirus? Currently, it's been found that this coronavirus, 冠狀病毒, is a similar type of virus like the previous SARS or MERS. This time, it is in the form of OC43. It was given the name SARI, as in S-A-R-I. There's still no known method of tackling this virus, this 冠狀病毒, this coronavirus. Health authorities in Hong Kong announced that this virus is very serious. Finally, WHO has increased the warning signs to medium to very high in China and high in regional and high in around the world. And this virus is also found to be able to enter your body if your throat or throat mucus is dry. Coronavirus, 冠狀病毒. The first character 冠 means crowns, like the crown of a king. The character 狀 means shape or state, like 形狀 shape or 狀態 state. The two characters combined, 冠狀 means crown-like. The third character 病 means sickness or illness. The last character 毒 means poison. The two characters combined, 病毒 means virus. What about Wuhan Pneumonia, 武漢肺炎? What do we know about it? Beginning from December 2019, there's been an increasing amount of cases of unknown pneumonia in the city of Wuhan, Hubei. China has now, just a couple days ago, put a restriction on people going in and out of Wuhan. There's also a ban on using private cars without a license, and all public transits have been halted. Gas stations are not functioning at all. And you can see how drastically different the data is just within a couple of days. As of to January 28, 2020, there's been more than 4,500 patients diagnosed with Wuhan pneumonia, and 106 people passed away because of it. You can see the data that I had from 6 days ago. You can see how exponentially the amount of patients grew already. Just please keep in mind that regardless of the number of people infected, this virus, 病毒, can now be spread from human to human and is airborne. And it was rumored that the first contact of this virus, 病毒, was from consuming wildlife animals, now suspected to be bats, field rats, amongst others. It was it started from bats, and then it got passed on to snakes, which interestingly, this virus can apparently live in both warm-blooded animals and cold-blooded animals. 武漢肺炎, Wuhan pneumonia. The first two characters, 武漢, is the name of the city, Wuhan. The character 肺 means lungs. The character 炎 means infection. The two characters combined, 肺炎, means lung infection or pneumonia. What are the symptoms? So as you've seen from the video clip earlier, the medical staff from Wuhan Hospital said that the earliest mutation, the first mutation, you will still experience some symptoms, but for the second mutation, you might not experience any symptoms. If it's the first mutation of this virus, the Hong Kong Control Center currently says that there are some symptoms of this virus such as 發燒, fever, literally burning up. Fast and high fever, hard to lower, but if successful, the fever will return very soon. 乾咳, dry cough, or cough. The next stage is coughing. In long duration, people affected are mainly children. Adults has mainly throat symptoms, together with headaches and physical discomforts. Elderly and young children are most susceptible, so take extra precautions. It sounds really serious right now, but is this Wuhan pneumonia actually that serious? 武漢肺炎係咪其實真係咁嚴重呢? Going by the logic of how this coronavirus is actually similar to SARS in 2003, I would say yes, extremely. It's scary, but I want to share this. During SARS in 2003, my mother, who was a nurse, got sick. She was quarantined for 2 weeks. I was a child then. I cried so much at school thinking my mother was going to die. So that's why, if you're outside of China or Hong Kong, you should still be concerned if there are cases suspected or confirmed. There are so many cases confirmed all over the world right now, not just in Asia, but also in France and Canada and the US. So please be very careful. Yet, because this is the Chinese New Year period, people have been traveling to China visiting friends and family. Soon after Chinese New Year is over, they're likely to go back to the country where they reside in. It might become a pandemic. Since the government's not really doing anything for us, one must take precautions to save yourself. But how? So first of all, avoid going to China during this period of time at all costs. If you must, make sure you wear a mask. Going to more populated places such as the metro or the public transit, also wear a mask. Put on a mask if you're experiencing any symptoms. Another precaution suggested is to ensure that your throat or throat mucus is always in a moist condition. In fact, they are suggesting not to allow your throat become dry, because in 10 minutes of being dry, the virus will always find ways to enter into your body. So do not refrain from drinking water. Always have a bottle handy. If you feel like your throat is dry, just drink some water anyway. Do not hesitate. The idea is to keep your throat constantly moist and wash your hands thoroughly. Make sure that you rub between your fingers and under your nails. For masks, 口罩 literally means mouth cover. 口罩. Look for the ones that are antibacterial. For flu and anti-dust, not just anti-dust. Make sure that for preventing you from getting sick, you will need a medical mask, not a sponge one. If someone coughs or sneezes at you, those droplets will permeate through the sponge mask and be directly in contact with your face. The sponge ones can only prevent your germs from spreading into the air. Always have antiseptic cleanser or sanitizer handy. Antiseptic cleanser or sanitizers are called 消毒液. The first character, 消, means remove. The second character, 毒, like virus. 病毒. By itself, it means poison. The last character, 液, means liquid. In combination, it means antiseptic. Finally, random Mandarin time. I know that a lot of Asians in the community feel like they're being targeted because, we are Asians and we are seen as a virus carrier for some reason. But let's not encourage that type of racist behavior. But let's say if you do see someone who might have just traveled to China and is showing some symptoms, what should you say? So when you want to ask someone if they're sick, try not to directly translate word for word. So for example, in Cantonese, do you have any illness? The direct translation is 你有病啊? 你有病啊? In Mandarin, the direct translation is 你有病嗎？你有病嗎？ Do not say that, because these phrases, both in Cantonese and Mandarin, have a negative connotation, as if you're trying to insult the person by saying that they're mentally ill. Instead, say in Cantonese, 你係咪唔舒服啊？你係咪唔舒服啊？ Or in Mandarin, 你是不是不舒服？你是不是不舒服？ Literally, are you, yes or no, unwell? Let me repeat. 你是不是不舒服 in Mandarin, and in Cantonese, 你係咪唔舒服啊？ Now, let's say if you're very unfortunately in contact with this infected person, put a mask on immediately because, like I said, this virus is highly contagious and airborne. If you're kind-hearted enough, spare a mask to the infected person so the virus is not going to spread. Kindly suggest the person to seek medical attention, and then you evacuate. If possible, try to quarantine yourself for at least 7 to 10 days. The latent period of this virus is found to be 7 to 14 days. And here's the list of vocabulary. 冠狀病毒 coronavirus 冠狀病毒武漢肺炎 Wuhan Pneumonia 武漢肺炎發燒 fever 發燒 cough 咳咳乾咳 dry cough 乾咳消毒液 antiseptic or sanitizers 消毒液口罩 masks 口罩 That's it for today. If you like what I do, like and subscribe to my channel. Comment below to tell me what you want me to talk about. See you next time at The Art of Hong Kongese by a Dummy.